Hello everyone, thank you for joining me for this webinar today on the rationale behind error categories. Tips to help you decide how to determine which error codes to apply. My name is Sara and I'm hoping to help take some of the stress out of grading your own reports. Why do I self-grade a report? Grading your own reports is one of the best ways to understand your errors. Seeing both the error and the correction is a great reinforcement and will help you to avoid making the same errors going forward. You must grade all of the reports marked required student grading in each chapter. Please do not look at this as an unwanted chore, but embrace it as a learning tool. These grades will not be included in your final grade. Be fair and honest with yourself. Remember, you are in training to be an MT, and it takes time and practice to learn all of the rules. Think of this exercise as performing a quality assurance audit on yourself. Once you have some experience in the MT field, some of you may go on to become QA specialists, and this is a great way to introduce yourself to that role. Before you get started, it's a great idea to gather your resources. I recommend the following along with anything else you may find useful. I call this the Self-Grading Toolkit. Account specifics, punctuation guide, book of style, error categories, and tea or coffee. Not mandatory, just nice. I would like to point out that for anyone who is currently in keyboarding, you do not deduct yet on book of style or account specific rules, as you haven't been introduced to those resources yet. You will use the punctuation guide, but you are going to be mostly concerned with spelling. Once you reach the grammar and style sections, you will start using BOSS or book of style, so you will start applying those deductions as well. Once you reach the body as a whole chapter, you will start using the account specifics as well. So you'll use all of the resources by the time you start the body as a whole chapter. Error categories. Error categories, there are 4 error categories and points are deducted based on the severity of the error. And we will go over each one individually later. But for now, let's just get our categories straight. First of all, critical errors. These are a 3-point deduction. These errors could greatly affect patient safety and care. Major errors, 1.5-point deduction. These errors are important, but probably would not cause a severe conflict in patient care. These could cause confusion. However, this category also includes failure to flag, which is a 1-point error. Minor errors, 0.5-point deduction. These errors include formatting and small grammar errors. This section also includes punctuation, which is a 0.25-point deduction. No point value, 0-point deduction. These are educational errors or FYIs. Fail, 100-point deduction. This is for an incomplete or nonsensical report. This category is only used by the instructors. Let's go over them in detail here. Critical errors. The following errors would fall into the critical category as each could cause a severe impact on patient safety. The patient was given Coversol, should be amiodarone. That's a medication error. The patient is getting an incorrect medication. That could be critical, even deadly to the patient. The patient was given 500 milligrams, should be 5 milligrams of Ativan. That is a medication dose error. Again, that could severely impact or kill the patient. The patient will be given potassium for hyperkalemia, should be hypokalemia. That is a medical word error. Hyper is too much, hypo is not enough. Either one of those conditions will cause a different treatment. You will not treat hypokalemia the same way you would treat hyperkalemia. The patient has edema. This should be no edema. Critical miscellaneous error for this is an omitted dictation. If the patient has edema, the patient will be treated for edema. Edema can also lead or give us a clue to other conditions or diseases that the patient may have. If the patient has no edema, the opposite, then of course they would not be treated for edema. Again, a critical miscellaneous error for that omitted word no. The patient was given HCTZ. Should be expanded to hydrochlorothiazide. It's a dangerous abbreviation. That will go under your medical word abbreviation error in the critical category. Dangerous abbreviations are always expanded regardless of where they are dictated in the report. Any dangerous abbreviation that is not expanded will always be a medical word abbreviation error and will always be a critical error. Major errors. So these are very important errors, but they would probably not compromise patient care in a severe way. We remove the discrete mass, should be discrete spelled differently, becomes an English word error. Discrete and discrete, spelled the two different ways, are called homophones. They sound the same, but they have different definitions. Discrete, ending in EET, means careful or intentionally unobtrusive. For example, the report was moved to a discrete location. Discrete, ending in ETE, means distinct and or unconnected. For example, works here, we removed the discrete mass. That makes sense. The mass was unconnected or distinct. I will follow up with the patient. One word should be follow up two word. This becomes an English word error as well. Follow up as one word is a noun. Follow up as two words is a verb. A great trick to determine whether you need this as one word as a noun or two words as a verb is to insert a different verb or noun in place of follow up. Try inserting appointment in this sentence. I will appointment with the patient. That doesn't make sense. Appointment is a noun. Appointment doesn't work. This is not one word, follow up. Let's try to substitute a verb in there and see how it sounds. Let's substitute eat. I will eat with the patient. Makes perfect sense. That is a verb, so follow up should be in the verb form, which is two words. At the end of the report, the doctor dictates, blood pressure is elevated, and the MT moved that sentence to the physician exam portion, or I'm sorry, the physical exam portion. This is not how it was dictated. This is called a change in dictator style. When we are transcribing, we always transcribe in the order things were dictated, unless we are asked to do something different by the dictating physician. In this case, the dictator did not ask us to move that sentence to another part of the report, so we're changing his style in which he was dictating. The patient's weight was 180 pounds. Should be 188 pounds. That is a major vital signs error. I should note that if there was a greater discrepancy, this could be a critical error. For example, if we said the patient's weight was 380 pounds, and it should be 188, that would definitely be a critical error. Often medications are dosed on a patient's weight. Therefore, if you're dosing it on somebody that weighs 188, but you're giving them the medication for someone that weighs 388, again, super severe or could even be fatal to the patient. No heading for assessment. That is a protocol error. On the next slide, we're going to go over some of the protocol errors, but basically a protocol error is any error that is a format or requirement of the account specifics that we did not follow. Our account specifics say to make a heading for assessment even if it's not dictated. We didn't. That is a protocol error or account specific error. So here are the protocol errors. These fall into the major category group and include any direction given in the account specifics that was not followed. The patient was given rosuvastatin. It should be rosuvastatin with a lowercase r. Account specifics says capitalize all medical brand names. Rosuvastatin is not a brand name and therefore should not be capitalized. She will receive a flu shot. Flu should be capitalized. It should be flu shot with a capital F. The reason being, account specific says capitalize the first letter of immunizations and vaccinations per the Book of Style 19.2.2. The patient was, and the MT or student didn't understand the next word, so they put in a blank, but they've done it incorrectly. They've put 2 underscores, question mark, and then 3 underscores. It should be 5 underscores, and that's it. If you want to take a guess, you can put a space after the underscores, put your guess in parentheses, and that is the correct way to leave a blank. Even if your guess is wrong, as long as you have done the protocol of the 5 underscores and the parentheses, there's no points deducted for that. You will avoid these errors if you remain familiar with the account specifics. Minor errors. These are small errors in omission, punctuation, etc. that are incorrect but have very little to no impact on the patient's safety. Some examples would be the patient was transferred ICU. Should be patient was transferred to ICU. We've missed out the word to. It becomes an omitted word. It's minor. Everyone would understand what is meant by that statement and would not affect anything. Patient to return if symptoms increases. Same idea. Should be increased. It's a grammar error. We understand what is meant by this statement. The patient has no allergic. Exactly the same thing. No allergies. Another grammar error. The lungs is clear. Should be are clear. That, again, grammar error. Being a medical transcriptionist is an exciting career. Medical transcriptionist should not be capitalized. Medical transcriptionist is a generic type of work. If we replace that with being a doctor is an exciting career or being a lawyer is an exciting career, we wouldn't capitalize that. So there's no capitalization there. Something I would like to remind you, though, is previously in our protocol errors, if we don't capitalize a brand name, that is a protocol error. So make sure that if it's a brand name, if you didn't capitalize it or you did capitalize it in error, that becomes a protocol error. Otherwise, these generic or everyday words are just a capitalization error. This is a verbatim account with the exception of grammatical errors and punctuation. We would, however, correct the tense if the dictator changes the tense in the same sentence. So if the dictator is dictating an operation in the past tense, we leave it at that. If he dictates one of those sentences where he's using past and present and it clearly can't, it's got to be one or the other, then we can correct that. But basically we let that go and just do the grammatical errors and punctuation errors. No point value. These errors have 0 point deduction and are used to show an acknowledgement, a tip, an FYI. He came into the office Tuesday, semicolon. However, he was booked to come in on Monday. He came into the office Tuesday, period. However, he was booked to come in on Monday. There is no points deducted for this. If the key did it with a semicolon and you did it with a period and it comes back highlighted, these are both acceptable. They're both correct. Doesn't mean the key is wrong, and it doesn't mean you are wrong. It just means there's two ways to do it, and you each did it different ways. No point values can be also used if you're pointing out an error that has previously been deducted. In our earlier example, we gave a capitalization error for medical transcriptionist. If you had written medical transcriptionist with capital letters throughout the report and you did it 5 times, you're only going to be deducted for the first one. The other ones are no point value. In fact, you don't even have to check them off, but you can if you want. Even though they're highlighted, you've already marked that error, so it's not another deduction. Again, blanks are no point value, but we would, you don't need to select anything, like you don't need to select the no point value. However, one blank can include up to 4 words. If you think you have more than 4 words, leave a blank for each group of 4 words that you think you missed. This is very important. If you have a paragraph and you can't hear it and you put in a blank, and there's actually a paragraph, as I say, there could be a number of words in there, you will be deducted for every missing word after the first 4 words. So be very careful. It's sometimes hard to tell exactly how many words you've missed, but be reasonable. If you're missing a lot of words and you feel like, oh, it could be 8, put in 2 blanks. Otherwise, you will be deducted. Don't feel that you can put in a blank and then pick up the report 2 minutes later, wherever they're dictating. Punctuation errors. Always refer to the punctuation guide to determine which errors are deductible. Remember, not all punctuation errors are deductible. The patient came to the hospital and he continued to vomit. Should be the patient came to the hospital, comma, and he continued to vomit. There should be a comma before a conjunction joining 2 independent clauses. And is the conjunction, and each side of the word and can stand on its own. Those could be 2 separate sentences. So that's why you need a comma. The patient was well. The patient left the hospital. The patient was well, period. The patient left the hospital. Those are 2 independent clauses, 2 complete sentences, not joined by a conjunction. So they have to stand alone with a period or a semicolon between them. The patient will rest, comma, relax, and ice his injury. Should be, the patient will rest, comma, relax, comma, and ice his injury. A comma is required before the word or and the word and in a series of 2 or more items. Fail category. Students are required to complete each transcription in the program and to self-grade all of the required student grading reports from each chapter. These reports provide the practice required to ensure you are experienced enough to be prepared for the workforce as a new graduate and is a very important part of your course. Poorly or incompleted reports will result in a fail, and their report will be graded at 0%. This category will only be used by instructors. If we find that you are not completing reports or not grading reports, you will receive them back in your queue. Okay, acceptable variations. When you receive a report back that has been compared to the answer key, not all the highlighted areas are errors. Sometimes we have acceptable differences. There can be 2 ways to format the same information, and both are correct. Take a look at the word calicele in Stedman's, and you will find it's spelled 2 different ways. Both are acceptable. So acceptable variations are also called allowable differences. What is an acceptable variation and how do I know I have one? I would like to stress that if you receive a report back where it is a section is highlighted and it's an acceptable variation, this is not an error in the key. Some people get this confused and say, well, no, I typed this correctly, and the key says it's wrong. That's because most often it's an acceptable variation. The key can only show one way. If you selected a different way to do it, it's going to highlight it. So examples. Canadian, U.S. spelling, both acceptable. We don't accept British, but we do accept either Canadian or U.S. So color, color, defense or defense, honor or honor, those types of words, we can accept either or. So if you typed color as C-O-L-O-U-R and the key showed it as C-O-L-O-R and it's highlighted, that's not an error. It's not a key error. That's not your error. It's an acceptable or allowable difference. Abbreviations, same sort of thing. IVIG with a capital G or IVIG with a lowercase g. AM/PM, capitalized, or AM/PM, lowercase with periods, both acceptable. D&C with the word and spelled out, or D&C with an ampersand. That would be the same with H and P and so on. That is an acceptable variation. Medications. Physohex or physohex, both spelled differently. If I looked up physohex, the box or jar or whatever would probably have a lowercase p, a capital H, and so on. This is a brand name drug, and that is their trade name. This is called idiosyncratic capitalization, or kind of peculiar lettering. This isn't normal English lettering. You can do either one. So if you type it physohex with a small p, or physohex with a capital P and the rest lowercase, that's fine. Miralax, same thing. NyQuil, capital Q or lowercase q. If the key does it differently than you, it's going to show as a difference, but in this case, it's allowable. Medical and English words. Healthcare and healthcare, whether it's one word or two words, we'll accept both. Piriform with a Y, piriform with an I. Same thing. Calocele or calocele, Y or I, as I mentioned earlier. You'll see them both in Stedman's. That makes an acceptable or allowable difference. Punctuation. Book of Style says we can use a colon or a comma with a salutation. So that's fine. Either one of those are fine. Reevaluation or reevaluation with a hyphen, we'll accept both. 5 and 9/12-year-old male, all hyphened, or 5 and 9/12-year-old male, not hyphened, both acceptable. I will provide a great link to an additional webinar specifically on acceptable variations that will cover these in detail that I think you'll find very helpful. Okay, so fine-tune your resources. When you open up a report, you will see at the top of the report, you can click on your various resources. There's the Acceptable Variations Guide. You can click on directions on how to self-grade. You can click on the account specifics, or you can even click on the video on how to self-grade. Excellent resources. And if you prefer those in the electronic version, like on your computer, that is perfect. Have them nice and handy. If you are like some people and me, sometimes I like to have a hard copy. So what I've done is I've taken the punctuation guide and I've taken the error category and I have squished them together and put them on each on a page. I put these back to back in a sheet protector and have this handy on my desk at all times. You can also reword things or include examples that make more sense to you. You can also do a 2-minute quick review each day to remind you before you start typing of the basic rules, just to avoid some errors. For the error categories, you can include examples that, again, make sense to you. You can do this with the account specifics as well. Rather than flipping through tabs on your computer, you might, and also pages, you might just want to condense it and just have it quick and easy to look at. That is my punctuation summary. That is really tiny, I know, and I apologize, but that's just to give you an example. The error categories, only an example, looks tiny, but that will give you the errors. And you might want to put, you know, as an example, is an age error. If you misstated the age, what would that be? And you might want to just write it in. Oh, well, that would go in this error, and so on, just to remind yourself. All right. Now it is your turn. Let's test our knowledge. What would you do? If possible, can you grab a piece of paper and a pen or pencil and see how we do with some of the actual errors? Okay, first of all, you typed he instead of she. The report is about a female and it was clearly stated she. What do you think that error would go under? And the most important thing is to know if you've got a critical error, a major error, a protocol error, a minor error, or a no point. Inside each of those categories, there is a place to put each of these errors. If you get that wrong, if you put something in as a miscellaneous and it should have been a protocol error, that is not the end of the world. Remember, this is for your benefit. So as long as you're getting the right class of error, then your marks will be reasonably true to what you have typed. Okay, so we didn't start a new paragraph for a physical exam. What kind of an error would that be? And some of these on this page are not errors. All right, so we typed 36-year-old, and it should be a 46-year-old. That'd be a critical or a major. We typed vicryl with a lowercase v instead of vicryl with a capital V. If that's an error, what type of an error is that? You typed bronchospasm, and it should be bronchospasm. Bronchospasm was clearly dictated. Critical, major, no point value, what do you think? Blood pressure was 110/90. Should be 110/80. Cranial nerves, 2 through 12. Patient male should be patient is a male. We've missed the words is a. He will see radiology. She had an IVIG infusion. Left hand were stiff. She will have a shingles vaccine. I prescribed 100 milligrams of Imovane, but the doctor dictated 1 milligram. Okay, Have you got your answers? Let's go look and compare them to the key here. Okay, dictated he and transcribed she. That is considered a major English word error. This could also be a protocol error. They're both major, but you didn't type verbatim. They said she and you typed he. That could also be considered not being verbatim. It's also an English word error. So as you see, as long as you get that category major, there could be some options as to which category you put it in. But it's a 1.5 error, and that's the most important thing. Did not start a new paragraph for physical exam. That will be a major protocol error, and the reason being is that our account specifics ask us to start a new paragraph for each section, and it's quite clear on when to break out those paragraphs. So review your account specifics on paragraphs. Typed 36-year-old and should be 46-year-old. That'll be a major vital signs error. It's an incorrect age. I should note this could also be a critical error if there was a greater discrepancy. If we had typed this 26-year-old and it should be 96-year-old, those two patients would be treated totally different. So that is a critical error. In this case, we would consider it a major. Typed vicro with a lowercase v instead of vicro with a capital V. Again, major protocol error. The account specifics say to capitalize brand names. Bronchial spasm should be bronchospasm. That is a major medical word error. Bronchospasm was clearly dictated. That could also be a protocol because of verbatim. Blood pressure was 110/90, should be 110/80. Vital signs error. This, again, like our age, could be a critical error. What if we had typed blood pressure was 210/90 and it should be 110/80? That would be they would be treating that two totally different ways. That would be very confusing and could cause some serious issues. That would be critical. Cranial nerves, 2 to 12. There's no error there. We can use Roman or Arabic. Patient male should be patient is a male. It's a minor miscellaneous omission. It's omitted text of is a. That would be one error. He will see radiology. Radiology should be capitalized as per our account specifics. The easy rule for whether it should be capitalized is replace it with a proper noun. He will see Dr. Smith. Works. That means radiology should also be capitalized. He will be seen in the radiology department. He will be seen in the Dr. Smith department would not be capitalized because that would not make sense. She had an IG infusion. No error there. Could be either or, lowercase g or uppercase v. Or uppercase g, sorry. Left hand were stiff. That is a grammar error. Should be was. She will have a shingles vaccine. That is a major protocol. Remember we said we capitalize vaccines, the first letter of a vaccine or immunization. I prescribed 100 milligrams of Imivane, should be 1 milligram. Okay, we've got a couple of errors here. Medication dose error. We wrote 100 milligrams. We transcribed 100. The dictator said 1 milligram. We also didn't capitalize Imivane, which is a protocol error. Okay? I hope you did well on that. Let's do some grading. So this is what you're actually seeing when your reports come in. Okay, so here's some answer key differences. The biliary tree was dilated. We've put through, the key is put to, the level, oops, I apologize, through to the level of the distal portion of the bowel bile duct. Okay, first of all, the word through is highlighted purple, which means that is what we typed. Note that there is a number on that error, number 23. When you are calling, it's awfully helpful if you can say, if you have a discrepancy and you can say, okay, on this report, could you look at error number 23? I don't understand why that's an error. Then we can go right to that error. So 23 is the error, 24 is what the key said. So what kind of an error do you think that would be? And the distal portion of the bowel versus bile duct. What kind of an error is that one? All right, the next one is error is number 110. I apologize, it's been cut off, but it is 110. We've written bowl instead of bowel sounds are audible. The patient has a markedly descended, should be distended bladder, which is extremely tender to palpation. There is no rebound, there's no rebound or guarding. Bowl instead of bowel, descended instead of distended. What kind of an error do you think that would be? All right, let's check it out. The biliary tree was dilated through should be to. That's a critical error. Oops, apologize. That is a critical error. The reason it is the word through means they cut through the biliary tree. The word to means they stopped at the biliary tree. That is a major difference. So that becomes critical. To the level of the distal portion of the bowel, we typed should be bile duct. Now that is critical. That's two different parts of the body. So is this person saying that they cut through to the distal portion of the bowel? Or is it cut through to the distal portion of the bile duct? We don't know. Two different areas, that's critical. Let's look at the second one. Bowl instead of bowel sounds. Now, that would just be a major error. This is an incorrect word, but it would not change the patient's treatment. The doctor would probably realize, based on the context, that this would be bowel sounds are audible. He goes on to talk about the bladder and so on. It's probably in the physical exam. It is a major word error. It wouldn't change the diagnosis or medications. The patient has a markedly descended bladder as opposed to distended bladder. That's critical error. Descended and distended mean two different things. These are homophones. No, excuse me, no, they're not. They're different means descended means going down and distended means protruding out. So if your stomach is protruding out and is like swollen and painful and tender, that would indicate some disease or conditions. If your bladder was descended, like falling down, that would indicate something else totally different. So that's a critical error. All right, answer key differences number 2. He will continue, he will continue aspirin 81 milligrams daily. Lipitor 80 milligrams daily, Welchol 1,875 milligrams daily, John 75 milligrams as needed, Zed 10 milligrams, Toprol XL TP to be increased to 100 milligrams plus nausine 2x niacin, or I'm sorry, 2x a day. So it doesn't look too serious, but there's a lot to unpack here. So let's go, first of all, with error number 76. What do you think that would be? Now, looking at that error, I'm thinking, okay, there's no purple. That would mean that is something that was dictated that I did not type. I did it again on number 77. You can see the error of John instead of Voltaren. We typed John, dictated Voltaren. We typed Z instead of Zetia. Missed Daily again. TP instead of 2. Nausine instead of niacin. And 2x instead of twice. And we missed the whole dosage, 1,500 milligrams. All right, let's see what our difference key says. Okay, he will continue aspirin 81 milligrams daily. Omitted dictation. It's a major omitted word, daily. Lipitor, 80 milligrams daily. Same thing, except we've already deducted for it in number 76. So that would be a perfect example of a no point value, previously deducted. Then we have an incorrect medication, number 78. We've said John, 75 milligrams is needed. It should be Voltaren. So that's, again, a critical medication error. That's an incorrect medication. I don't know if there's a medication called John, but it's certainly not Voltaren, so that's critical. Number 80, Z. It should be Zetia, 10 milligrams. Again, critical medication error. Daily was missed again. Omitted dictation, we've already marked that. Toprolol XL, TP instead of TO. That clearly is just a typo. That would just be a minor. If they had put capital TP, or if TP actually stood for something that might make a difference, if it was an abbreviation, it might be a different story. But it really isn't. It really is a true typo. So that should be 2. That's a minor error. Nausine, 2x. So nausine should be niacin. Another critical medication error. 2x, well, the dictator said twice a day, and we've changed it to 2x. That's a change in dictator style. He said one thing, we said it another way. And number 88 and 89, totally omitted. We didn't even put a medication dose. That becomes a critical medication dose error. We're missing the dosage, 1,500 milligrams. I do want to give you a tip that you might find helpful when looking for drugs. Sometimes it's hard. You can hear the dosage or you can hear the start of a drug, and you don't really know where to look. Here's a tip. Go on to Google. Type in the dose. So let's take Zetia. Type in 10 milligrams. Space, like so 10 space, milligrams space, type in Z. It's going to bring up the medications that are dosed in 10 milligrams that start with Z. So that might help you to find the medication you're looking for. Now this person thought it was Z, so maybe ZE, or I'm sorry, ZE would help you narrow it down even more. Type what you think you're hearing. Those medications will come up and you might just find what you think you're hearing, and then you can go from there. That's just to get you pointed in the right direction. As we all know, Google on its own is not always correct, but it puts you in the right direction. Then you can go check that. So let's say, oh yeah, he did. He said Zetia. That's exactly what it is. But I don't know if that's a brand name or what that is. Head on over to drugs.com, type it in, and it will tell you whether it's a brand name or if it's a generic name. So you'll know whether to capitalize it or not. That's usually an easy, quick way to kind of research it out. As I say, sometimes you've got the dosage, and sometimes you don't, and you've got just the name. Something else too is if you can hear the name, let's say it's Zetia, and you're thinking, did he say 100 milligrams or 10 milligrams? Check out Zetia. How is it dosed? Go to drugs.com. Maybe Zetia comes only in 10 milligram tablets. Well, I doubt very much that the doctor is going to give him 10 Zetia a day. So 10 milligrams would make perfect sense. Again, if you're ever unsure, leave a blank, 5 underscores. You are not deducted for those unless you have excessive blanks, like if the whole report's blanks. But you're not deducted. And put your guess in the parentheses. I think that's a great idea because I think a lot of you will be surprised how many times you're correct. So, and that really helps your confidence too. So that hopefully is a tip that will help you fine-tune some of those medications and their doses. There are some terrific additional resources. First of all, under the Overview tab in the course, you're going to find the self-assessment guide, the video on how to self-grade a dictation report, the list of MT websites that can be very helpful and are recommended or suggested. Always a good idea to check things out, find your favorites, and go with those. The dangerous abbreviations, you might want to have the most common ones on your little cheat sheet, just so that you're aware of them. There are also some terrific webinars on the forum. If you don't know how to access those webinars, you just need to click in the course on Forums, on Forum. It'll take you to the forum. Sometimes you have to log in. If it says log in the top right corner, click on that, log in, and then in the search bar, you can type in webinar. And it will give you a list of all the webinars done each year. If you know it's the webinar on the DictoScribe self-assessment, you can type in DictoScribe self-assessment, and it'll take you right to that. So that is one I actually highly recommend. I mean, I recommend them all. I think they're just terrific. But DictoScribe self-assessment help was done by Lori, and it goes into even more detail how to physically mark your reports, your resources, and so on. And it's got great examples of errors and so on. It's an excellent webinar. Acceptable variations, that was done by Lisa and Deb. Again, it's 1 hour of going through the acceptable variations, all the sort of different ones and how to rationalize them. I think it's a great resource. Account specifics webinar. I apologize, I don't know who did it, but it goes over the account specifics, and that's very helpful. Something else that I know when I talk to some people, they don't have time to sit in front of the computer, or that's what they've done all day and they're so tired of it. They just need a break. They just don't feel like watching a webinar. Listen to a webinar. Sometimes, even if you picked up 75% of the stuff, that helps. Do the dishes, do something, but have your webinar playing, and you'll be surprised how much you can pick up. And don't forget, you can watch them anytime. You can stop them and start them and do whatever you want at your convenience. So anyway, I can't speak highly enough about the webinars. Okay, so, and of course, if you have any questions, you can reach instructors at any time through Pure Chat, email at instructors@canscribe.com, and by phone. Just call into the college with any needs and ask for an instructor. Pure Chat information can be found in the FAQ section, and that's the link if you want to get directly to it. Thank you for joining us today. I really appreciate it, and I hope this was of some help to you. I really mean that the only real mistake is the one from which we learn nothing. There is no way you should not be making mistakes. That's what you're supposed to do, but the important thing is learn from that mistake, take it to the next report so you don't make the same mistake over and over. And I think you'll be super surprised by the end of the course how well you know the count specifics. Your punctuation is going to feel good, and you're going to be making very few mistakes. Again, thanks for joining. Goodbye.